We've got 21 prisons across the state. They're all over the place. And we have just over 20,000 inmates incarcerated in the state of South Carolina currently. Prisons were put in rural areas for jobs and things of that nature back when they were built, which was a good thing for the jobs. However, it was not a good thing because you do not have a lot of professionals that live in that area. A lot of the medical staff lives, as you know, in Charleston, Greenville, Columbia, and the surrounding areas. When I first arrived at Department of Corrections, October 1st, 2013, as the interim director, came in and wanted to see what was going on at Department of Corrections, and I saw that a lot of our inmates were being transported for healthcare reasons to various medical facilities around the state.
Telehealth came into our system through the approach of MUSC. Since our inmates are considered underserved population, they approached us to see if we would be interested in using that service and if it would be assistance to us. And in our rural areas, especially our outlying facilities, we felt it would be very beneficial. We've been doing telepsychiatry with MUSC for about 8 years. We have a very shortage of psychiatrists. They're difficult to recruit, difficult to find. So in collaborating with MUSC Psychiatry Department, it enabled us to expand our coverage and our access to healthcare and psychiatry positions throughout the state. And now we're basically kind of piggybacking on that same type of service that we've utilized with telepsychiatry, with telemedicine.
This program's model is really focused on urgent care needs. Currently in South Carolina prisons, they have nurses who are 24/7, but the doctors and nurse practitioners, they are typically staffed more work days, 8 to 5. It creates a very vulnerable situations for inmates if they have urgent care needs during those vulnerable hours when a medical provider is not on site. And so this program tries to minimize that vulnerability by allowing the correctional facility nurses connect and communicate with a medical provider here at MUSC.
That's pretty cool.
Based on the medical history, based on the exam, they're able to provide their diagnoses and order any medication or additional exams. During the exam, our medical providers at MUSC are able to distinguish the difference. Is this an emergency? Is this an emergent care need? If so, they go ahead and make the recommendation, transfer the patient to the nearest hospital. Traditionally, even if it is an urgent care symptom, they were transferred because they were needing to be seen by a provider. For most urgent care needs, the telehealth consult and exam is able to be more than sufficient. They are minimizing unnecessary transfers, and that's important for our emergency department because there are times when we're very busy, and when an inmate is transferred, they're accompanied by 2 correctional officers, and in those busy peak times, the added people that come along with the inmate makes the emergency department even more crowded.
The less that we can transport our prisoners, the better for public safety and the better for taxpayers. There are serious things that we have to treat, and some of those obviously can't be treated by telehealth, but a lot can, and I think we're on the forefront in correctional care of doing this. We're going to take advantage of technology to save tax dollars and advance public safety.